I also got the question about what supplements help with knee pain. And honestly, I can't really remember what this quote is, but the way I remember it is you can't outdo your fork. I think that like you can't outrun a bad fork, or you can't outdo a bad fork, something like that. What it means is you can't add supplements to counteract what you're eating. I mean, of course you can, but for long-term relief, it's not going to work the way you want it to. So that's why I talk so much about doing the anti-inflammatory diet and having good meal plans instead of adding in supplements, or instead of taking non-steroidal anti-inflammatories, or instead of doing the cortisone injections. Because yes, maybe the anti-inflammatory, the non-steroidal anti-inflammatories like Advil, or the cortisone, or maybe some turmeric or collagen, they might help a little bit. They might help relieve some of the pressure, tension, pain for a short amount of time, but it only lasts for so long. And the best way to get long-term relief is to eat ways that support your body. And there are many different ways to do an anti-inflammatory diet. You could go gluten-free, you could go dairy-free, both nightshade-free, sugar-free. I already said dairy-free, meat-free, you could go vegan. They all can work. The main thing that they all have in common is that you cook for yourself and you're not having processed meals. So if you look at an ingredient list of meals at restaurants, prepackaged things at the grocery store, and you see a laundry list of ingredients and you can't pronounce any of them, then that's not the right kind of meal. That has too many processed things, chemically manufactured things to mimic food, to trick our body into thinking that we are getting the real thing, but we're not. And so doing an anti-inflammatory diet, the biggest thing they have in common is you cut out all of those processed foods and you cook for yourself. You cook real food. So it's chicken and carrots and broccoli and rice and strawberries for dessert. Like that's, at my house the other day, I made chicken with sweet potato to add a little sweetness, some Brussels sprouts, and then for dessert, we had some watermelon. Now, I'm very open that we have gotten to the point in our family where we do still have candy every once in a while, but it's the fun size candy. It's those little like Halloween sized treats. We'll have a Snickers, maybe two, and that's fine for me and my husband. But there was a time where we didn't have any of that. We cut it out completely. And that's what I recommend people do, because the sugar and then the processed foods, when they are digested, your liver will turn them into fatty acids, which then increases an inflammatory reaction that's already going on, or creates an inflammatory reaction if it's not going on. So if you add supplements to that, you're not changing what your body's doing on the inside. So it's still happening, and you're just doing damage control instead of prevention. So damage control, you're going to have short-term relief. Prevention, you're going to have much longer-term relief. And so that's the kind of thing I recommend. If you are looking for actual supplements to take, I do highly recommend talking to your physician to make sure you can take these, because these next supplements that I'm going to mention are blood thinning supplements. So if you're taking any kind of medication that already thins your blood, so Advil, ibuprofen, aspirin, those thin your blood a little bit. And then definitely if you're taking a Coumadin, a warfarin, what are I can't think of the other blood thinning names. Like if you've had a stent in your heart placed, or if you have AFib, already taking blood thinners, so you have to be really careful of what supplements you take. But turmeric is one that has an anti-inflammatory effect, and apple cider vinegar as well. So, but like I said, both of those are blood thinning agents. I don't recommend you take them unless you talk to your physician first, because if you take a blood thinning agent on top of a blood thinning agent, or if you have the opposite effect and you have a blood clotting disorder and you take medications um, to help with that, either to thin out the blood or make sure it's coagulating appropriately, you need to talk to your physician. So that's one of the reasons why I don't recommend supplements, is because they can interact with so many different things. One thing that I personally take every day, and it may or may not help. To be completely honest, I won't know for me if it's going to help me until 20 years from now, but it's collagen. So theoretically, adding in collagen powder can help support your cartilage. So I buy Vital Proteins or Orgain. I like both of those brands, and you can find both of those brands at Costco. I also, for Orgain, I actually have a discount code if you want to try any of their protein powders or anything. I don't get anything from that. It's just I use it regularly, and I'm a healthcare provider, so they gave me a link to share with people if you want to try. I think it's 30% off. It's 20 to 30%. I've shared it with some of you already. Like I said, I don't get anything from that. So I just happen to use it every day. Love it. So that's Orgain Collagen or Vital Proteins. Those are the two brands that I use. And like I said, it may or may not supplement your joint health, your cartilage health. It's not going to eliminate the pain. It potentially can help rebuild some cartilage if there's minor, mild damage. If there's severe bone on bone, I don't know. I don't know. But it's a great way to get protein in. The kind I buy is flavorless, and I just put it in my my smoothies every morning. So let me know if you want more information. I can share links on the two brands that I just talked about. But like I said, for anti-inflammatory supplements, talk to your physician first, because you want to make sure that it's not interacting with any medications that you take. And that's one of the reasons why I just typically don't recommend supplementation. But also, long-term findings show that the supplementation is just so short-term, and long-term it's really cutting out that sugar, cutting out processed foods. And so those are things that I help people do, and that's what, in the Move Better method, that's what I guide people through. I give them, weekly meal plans. I give them ways to choose their own meals, because some people don't want somebody else to say, here's the meal plan. They want to be able to learn how to pick and choose themselves. So I do that. I also help people prevent, prepare for, and recover from the knee replacement surgeries. And then I also have that weekly. I don't know why I keep saying monthly. The weekly exercise class, where you get a new exercise. It's every Wednesday morning to practice for the week of exercises that are gentle and effective to calm down knee pain and strengthen your body. Right now, we're mainly focusing on legs, but in long term, looking at whole body workouts as well. But there's only so much I can do I do it in a 30-minute chunk, because I don't believe you need to do exercises for more than 30 minutes a day. So I keep to that as best I can every week. And those go out, like I said, every Wednesday morning. So if you're interested in learning more about the protein powders or the ways that I help my clients improve their strength, fitness, balance, flexibility, nutrition habits, I have ways that I help people do that as well. And you just have to ask. So that is everything for today. I hope that was not too rambly. Today I feel a little talkative, so it might have rambled a little bit. Sorry about that. Also, Levi's here snoring next to me, so it was a little distracting. Anyway, I will talk to you soon. Don't forget to leave some comments, and I will reach out to those comments. Bye.